is our supervision training series that we're doing with BHSD. This is actually our last one. So I think we're ending on a great note. So, and thank you everybody for being here and for everyone who supported this series from the beginning. And so I'm really happy to introduce our presenter, Michelle Herron, who is an LCSW, and she is a licensed clinical social worker who obtained both her bachelor's and master's of social work from Western New Mexico University. Michelle's social work roots have been present throughout her life, growing into chaplaincy in 2009 and later to her graduation with her master's in 2018. Michelle's work with substance abuse has been her heart. Working in geriatrics with youth and has also been very dear to her. In 2021, after completing her clinical supervision through UNM, she began providing teletherapy part-time while working as a full-time care coordinator for managed care organization. After many months of providing services, the need for assistance of those seeking mental health and substance abuse services continued to grow. Herron Solutions began by bringing on additional therapists and grew into a behavioral health agency, BHA 432, and in only 1 year grew to over 20 providers, including both therapists and support workers. A year and a half later, Herron Solutions has opened their 5th location in Albuquerque. Herron Solutions is now in Socorro, Belen, and Albuquerque. So without further ado, I'm going to have Michelle take it away.
Thank you, Lisa, for that. I do want to say thank you to Lisa and Jen. They were, and I still consider them my supervisors in getting me started in the direction of all of this. So I'm very thankful to have the program from UNM that did provide that supervision. It is a great program and able to get some high quality supervision and be able to still have those long-term connections. So I'm very appreciative of that. So thank you very much. Today we're going to talk about, this presentation is about supervision of credentialed professionals in the behavioral health setting, ensuring ethical practice and effective supervision, and promoting professional growth and healthy boundaries. As Lisa said, my name is Michelle Herron, and I am an LCSW, a licensed clinical social worker. And today I come to you on behalf of being a supervisor of credentialed professionals, both with the LCSW, but also with the LADAC. And the purpose of this presentation is to discuss, to sum it up, to discuss the importance of value of certified and credentialed professionals and being able to understand what their scope of practice is what we're going to start with, and then we're going to travel into some different areas. But I'm not sure what our audience looks like yet, but we're going to go through each of the different type of credentialed professionals, ethics, boundaries, and then why credentialed professionals are so important to our team. So disclaimer, the views expressed in this presentation are those of myself and they do not necessarily represent the views, policies, and positions of the University of New Mexico. Disclosure, I do not have any financial arrangement related to the contents of this activity. You will be able to obtain CEUs for this presentation. You do need to make sure to stay logged in for the entire time until it has been completed. There will not be partial credit given. So if you log out after an hour, hour and a half, you're not going to get the full credit. You do have to stay on for the entire time of the presentation. And at the end of the presentation, you will get a QR code, which you can scan, You have 48 hours from today to be able to complete that evaluation, and you will then get a certificate. You will get that automatically. It's generated right after the evaluation, and you will either print it, save it, screenshot it. It will also come in an email, but please make sure to save it because we will not have access to send that out to you afterwards. If you have any questions, concerns, feedback with that, you are able to reach out to Clint, CLINTBH, at salud.unm.edu. So our learning objectives for today, we have 3 learning objectives. Our first learning objective is to describe the perimeters of certified and credentialed professionals' scope of work, identify supervision techniques that can assist certified and credentialed professionals to establish their own personal and professional boundaries. Our learning objective number 2 is to explain the ethical guidelines and considerations relevant to certified and credentialed professionals in behavioral health. And our learning objective number 3 is to discuss the benefits of having certified and credentialed professionals on a multidisciplinary behavioral health team. As all of us know, I'm probably speaking to the choir on this call, on this presentation, but we know that there are many people out there that have and are continuing to seek mental health and support services. Just on this graph alone, you can see from 2002 to 2022, the gradual growth and what that's been looking like through these past years. COVID did have a big impact on that, but even without COVID, it was already gradually increasing. You look at from 2002 to 2022, and you can see it's almost doubled. And unfortunately, don't really see that coming back down. So the need for both professionals, therapists, counselors, social workers, the need for those type of professionals are very much needed, but also the credentialed professionals are very much needed due to all of these needs and these not only people needing the mental health side, but also needing the support services that therapists are not able to provide. So we know there's millions of people that are dealing with depression, anxiety, co-occurring disorders, substance abuse disorders, PTSD. We know that the list goes on, and it's all over the world, but it really is affecting people in the US, in our states, in our communities, in our cities. So who are credentialed professionals? Credentialed professionals are licensed substance abuse associates, LSAAs. They are licensed alcohol and drug abuse counselors, LADACs. They are certified peer workers. They are community support workers. I consider them the backbone and everybody behind sometimes it seems like there are behind the scenes that allow us to keep everything together and to be able to provide the services that our clients need on a day-to-day basis. So we're going to talk a little bit about each of these credentialed professionals, what it looks like, what their scope of practice is, and what it looks like to be able to obtain that credential. So for the licensed substance abuse associate, they are governed by the Counseling and Therapy Board. An LSAA is able to provide one-on-one substance abuse counseling and group process services to patients. They do have to have a direct supervisor who oversees them, and that direct supervisor doesn't have to be sitting right next to them in the room for every individual or group counseling session. But they do have to review case videos, do case reviews. They need to listen to audio tapes, if that's a thing anymore, audio tape, MP3, and also videotape or MP4s to make sure that the clients are getting the best type of services available through that LSAA, through the supervision. The LSAA has to be 21 years of age, have at least an associate's degree in counseling or related field, or in substance abuse. They have to provide sealed transcripts to the licensing board. They have to read and agree to the standards of the Code of Ethics of Counseling. And they have to complete 90 clock hours of education and training in licensed alcohol and drug abuse education. So those could be various CEU classes or training classes. And they can also be classes from a college or university. If you use college credits, 1 college credit equals 15 clock hours. So if you go with college credits, then you need 6 college credits to equal that 90 clock hours. Sometimes people look at the 90 and it kind of is a lot. They don't realize that they can do that through taking a couple of college credits on substance abuse and related information. And then they also have to arrange for the appropriate supervision, because they will need supervision throughout the time that they are an LSAA. So I'm curious out there today, do we have any LSAAs in our group today? Anybody out there LSAAs today? So no LSAAs today. Okay. So I am always looking to grow different professionals, and this is one area. Whenever our credentialed professionals come on, I really encourage them to get started in this area, because I want to encourage the growth of, because the need is so great, and because we are not able to do all of these things on our own. I really encourage our CSWs or whatever field, wherever field they're coming from. I don't push it on them, but I do like to encourage them to look into the education, look into what it may take, and if this may be an area that they may want to go into, because it will not only help our clients, but it'll also help with our employees to help grow them and help give them more skills, so that it will help them throughout their career and they don't have to just remain stuck. We really promote growth and education and learning. So this is one area that I am really pushing. We do have, I can think of at least 3 or 4 that we're trying to get in for the fall semester at CNM, because they do have an LSAA program there. And it's CNM is pretty reasonable in pricing. So even if they don't qualify for any grants or anything like that, they will still be able to assist them in getting that education that they need to get started. For the LSAA, as you saw, it did say they do need an associate's. So it will be 2 years of education that they will need to get to that LSAA. So our next one that we're going to talk about is the LADAC. The LADAC is a licensed alcohol and drug abuse counselor, and the LADAC is the next step after the LSAA. So you have to start with your LSAA in order to work towards your LADAC. And I take that back. You don't have to do the LSAA, but you can get the LSAA and be working on that towards the LADAC. You can just go straight to the LADAC, but you won't be able to do certain things until you have, you'll still need that associates, is what I mean. You'll still need the associates to get there. So the licensed alcohol and drug abuse counselor, they're able to do one-on-one and groups also, just like the LSAA, but they're not limited to certain things. They can do screenings, they can do intakes, they can do orientation, assessments, evaluation, referrals. They can do treatment planning, crisis intervention. They're more of an independent licensed alcohol and drug abuse counselor, although they still have to be overseen. They have more freedoms in their practice. So the LADAC has to at least be 21 years of age. They do have to have an associate's degree. So it makes sense if they already have to have that associate's degree, they might as well just start with that LSAA, because basically if they've already taken a couple college classes for substance, they're eligible for that LSAA already. And then they will need to also abide, read, and agree to those code of ethics. And then they also will need 276 hours of education and training. So instead of just the 90, they need 276. And I think I calculated it comes to a little over 6 college classes. It's a little over 18 credit hours. So they can do it that way, or they can do CEUs or other training classes that deal with substance. They do have to go through a period of supervised experience. They do have to pass a national certified addiction counselor level 1 examination, and they do have to send their transcripts to the board. So for the LADAC, you can have various levels of education. Depending on the level of education determines how long, how many hours of client contact, and how many hours of supervision is needed to be able to obtain the LADAC. So if you have an associate's degree, you have to, and you're not going to go any further, you have to have the minimum of 3 years and 3,000 client contact hours, 200 hours of appropriate supervision. If you have the bachelor's degree, you have to have a minimum of 2 years, 2,000 client contact hours, and a minimum of 100 hours of supervision. And if you have your master's or doctoral, you do have to have at least 1 year and 1,000 client contact hours and minimum of 50 hours of appropriate supervision. So it sounds like a lot, but it really does go by fast. I always explain to whoever I'm trying to encourage to go this path, if they start off with that LADAC, they're working for those 2 years to get their associate's degree. They're already getting these hours in. Once they're an LSAA, they can start getting paid at those rates for therapy as they're providing these services to the clients. Then they can continue working towards that LADAC and their counseling or social work degree, because they're going to be doing that school anyway. They can have this to assist, financially, and give them the experience they need as they're going to need to grow as a therapist or a counselor. They'll have this already. And then once they get to their 4 years, they can have their LADAC, and they can also have their bachelor's at the same time. Again, I'm partial to social work, so I try and lean them that way. But if they want to do counseling, I'm also good to have them go that route as well. But I just believe that this education and the experience will just open so many more doors for them, to where there won't be limits on what they can do and who they can help. And again, talking about how the need is so great, this just also helps us not only, as individuals for work and for our clients, but also as an agency to be able to be more well-rounded and offer more services that these clients need on a day-to-day basis. So do we have any LADACs out there today? No LADACs.
It actually looks like we have one. Robert.
Okay.
Yeah.
Hi, Robert.
Hi.
Hi. So I'm glad that you're here with us today. Can you tell us a little bit about how you obtained your LADAC? What did that look like? Did you have any difficulties when you were getting that LADAC? What did that look like for you?
Oh my God, it was in 2013, I believe. So anyways,
2013?
I had my LPCC and a LADAC.
Okay.
But I was still in my graduate program for my master's, and I was going to go on internship, and I decided to apply for the LSAA. So when I completed my courses, I went into the LSAA program, or applied for it and got it. And so it's already accumulating hours for, I got my LSAA, which kind of has really opened the doors for my LADAC too as well. So it was a really relatively, I won't say easy, but it was just a good transition, from having my LSAA and then my LADAC.
So Robert, did you have any difficulty in finding an agency as an LSAA to start practicing? What did that look like?
Actually, here in our community in Zuni, Pueblo, we have an outpatient substance abuse center. It's called Zuni Recovery Center. So I did my practicum and internship there. And so I also did my LSA hours here in Zuni. So it was only when I was trying to get my LPCC when it was really challenging. So there was no master's level clinicians here. So that was the challenging part.
Okay. So from your LSAA to your LADAC, it was kind of smooth as far as supervision?
Yeah. And there's like at least about 5 or 6 LADACs here in the community. And I over here at Shumagola Health Center, where I'm coming from, I have my one behavioral health tech as an LSAA. So she's working on her LADAC right now.
Awesome. Do you find, just one more question for you, do you find because you went that route, do you find that you try to encourage more people to go that route as well?
Definitely, yeah. Yes, I did.
Because you see the importance?
Right, yeah. So I'm still actively recruiting people like you are, even so I'm the opposite. Social work, I'm trying to get them into counselors.
That's okay. That's okay. Like I say, I'm partial to the social work, but
Right.
I do supervise some counselors as well. And I
Yeah.
just feel that the LSAA and the LADAC, they just open so many doors, but I'm sure you see the needs there in Zuni and throughout the state of how important it is to have those LSAA and LADACs.
We have a we have a social services program here, and at least one of the workers is pursuing a master's, and he was requesting supervision from me. So I think she's going to go through like a written thing about, I know there's certain hours, so many hours that you can use from a clinical supervision to meet social, but having given the rural area, I think she's going to try to apply that. She's going to try to attain all her supervision hours from here, but I'm not sure how that's going to work out.
Great. Lisa?
Yeah, so we also have another person, Juanita, says that she's a LADAC.
Juanita, welcome. Where do you practice? You're on mute if you're trying to talk.
It looks like she may not have audio. So
okay.
She works for an MCO now.
Okay, great.
I think this is a great example of how varied
yes.
People's experience can be and what people can find as a LADAC.
And different areas, different fields they can work in. So it's not limited, definitely. So that's awesome. Great. Thank you guys so much. So our next one is our credentialed professionals are our CPSWs, and our certified peer support workers. They have to be at least 18 years of age. They do have to have a high school diploma or a GED. They have to self-identify as a current or former consumer of mental health or substance abuse services, and they have to have at least 2 years of mental health or substance abuse recovery. They also have to be certified as a CPSW. The CPSWs they have to have 40 hours of either volunteer or paid work. They have to complete an application online, follow the CPSW Code of Ethics, do a training with peer support workers training for 40 hours, which is a week-long training through OPRI. And then they also have to get certified through the New Mexico Credentialing Board. Any CPSWs today? Seen any, Lisa? No? So I just want to share a little bit here about the CPSWs. I have people on my team that qualify to be a CPSW, but we have had difficulty in getting them in for the training. It was closed through OPRI for a little bit, and it just opened again in May. And then I did look last night, and it looks like they're going to have a couple of classes, but these classes are limited to like 25 per class. And again, these classes are 40 hours a week. It's pretty intense. The program is very intense. And I really wish that there were more options to be able to go the CPSW route, because I do have a lot of people on my team that could benefit from having this certification. So right now what we do is we have them as CSWs, and I'm going to share a little bit about that one next. But we are also looking into a national, and I'm not sure if the state approves that national certification. So we're looking into that because of the limitations of CPSW training in New Mexico right now. But the peer support workers are so needed because they offer that lived experience to our clients, and they're able to do a lot more. Their scope is wide, so they're able to walk with these clients in different areas that we might not be able to. So the last credentialed professional that we have here is the community support worker. And we say either CCSS or community support worker. CCSS is Comprehensive Community Support Services. The CSW is the community support worker that provides these services. They must be at least 18 years old. They can have different levels of education. If they have a bachelor's degree, they only need 1 year of relevant experience with the target population, whether that's mental health or substance use disorder. If they have an associate degree, they have to have at least 2 years of experience. And if they have a high school diploma or GED, they have to have 3 years of experience. They can be a certified peer or family specialist. The community support worker has to take 20 hours of training, and those classes, I am very happy to report that those are monthly, and we have some great trainers there that put that CCSS training on. It's about 2.5 days, I believe, the last time I checked. You do have to do pre-work, you do have to do post-work, and you do have to also do 20 hours of CEUs yearly to maintain that. So the community support worker is a little easier to get into at the beginning than the CPSW. So we use this as a stepping stone, and because we also would like our CSWs to have the CPSW whenever we're able to get them into that class. But at least as a CSW, we're able to get them in, get them training, and then we're able to get them working with our clients in this area right away, and not have those credentialed professionals on our team, knowing that they have this experience that they can be very beneficial to our clients. We want to get them to work as soon as we possibly can to be able to bring that support to our team. So, any community support workers today?
Yes, I am one. My name is Joshua Williams.
So Joshua, are you seeking any further education or credentialing?
I am on the pathway of the LSAA to LADAC to social work. That is my plan.
What's your inspiration?
My inspiration?
Mm-hmm.
My clients.
Awesome.
The eye-opening moments of an achievement or a barrier broken, though that's my inspiration.
Awesome. Thank you.
Yes.
Any other CSWs?
I am also a CSW. My name is Samantha Williams.
Thank you. Thank you, guys. Thank you for being here. Any others? Okay, so what we all know is professional growth begins from knowledge, and the credentialed professionals, from what we have found over the past year and a half since we began our agency, is the importance of knowing their roles. So each credentialed professional, the importance of knowing their roles, that lies on the supervisors, that lies on our agency, that lies on our team, to make sure that each of these credentialed professionals not only know their role, but that they're supported in their roles. And that's where we found that it makes it easier for, once they know their role, then they know the codes and ethics and the guidelines they'll follow. And then that leads to being able to uphold those boundaries. So the importance of ethical guidelines are, as such, the LSAA and the LADACs are covered under the ethical practice of the State of New Mexico Counseling and Therapy Board. The counseling profession, like many others, adheres to a code of ethics to ensure the highest standards of professionalism, integrity, and client welfare. While there isn't a single universal code of ethics for all counselors, several organizations have established their own codes that serve as guiding principles and ethical practice. So as we all know, there are many types of ethics codes that we follow. Some can be national, some can be regional, some can be state, and just making sure that we are very engaged and make sure that we're very always looking to see, to be upheld to that standard, and knowing that there can be some code of ethics that we follow, maybe from the American Counseling Association, some from the NASW, some from the American Psychological Association. Some of us follow the National Board of Certified Counselors, but knowing that we all follow these codes ultimately to make sure that we're providing the best services to our clients. So that there was some things in the chat, but I didn't know if they were from before. So just the importance is code of ethics are very important. The code of ethics are most important because they protect our clients. And that's why we need to know what they are, know which ones that we follow for whatever our profession is, or as credentialed professionals, and then also which our agencies follow. We need to make sure that we are very aware of all of those. Again, as supervisors, that is our role, to help our credentialed professionals to know what those code of ethics are. So the codes typically emphasize the importance of respecting clients' autonomy and dignity, maintaining confidentiality, avoiding conflicts of interest, providing competent and ethical services, and engaging in ongoing professional development. It is essential for counselors to familiarize, and not only counselors, but social workers and credentialed professionals, to familiarize themselves with the specific codes relevant to their practice and to integrate ethical principles into their daily work with clients. A huge one is confidentiality. Confidentiality is a cornerstone of ethical practice in the behavioral health. Professionals must safeguard client information and only disclose it with the client's informed consent or as required by law. Upholding privacy rights fosters trust and encourages open communication between the client and the therapist. So whenever we do our intakes, and I believe it's this way most agencies, is when we do our initial intake, we want to make sure that we let the client know that everything that we speak about is going to be private and confidential. We also disclose and let them know that there are going to be a couple of reasons why that confidentiality could be broken, and that will only be as if they tell us they're going to hurt themselves or they're going to hurt somebody else. The other way that we will disclose is if a client has signed a release of information. And when they sign that release of information, we also make sure that we're very specific as to what they want us to share and who they want us to share it with. So as we have learned, I'm from a small town, and small towns are very difficult in areas of confidentiality sometimes, because sometimes different agencies have broken that confidentiality, broken that trust with clients. And sometimes it takes a lot for us to be able to get that back and helping them to understand that, you know, we're sorry if this is what may have happened at this agency or at a different place, but this is how we do things, and this is how we are going to respect your privacy and confidentiality. So that ethical practice is not always upheld by everyone, and we like to make sure that our agency and we teach our credentialed professionals how important that is in building that rapport with our clients, because the better rapport we build with them, the better their outcomes are going to be, and also the more they're going to be open to work on the things that they need to work on so that they can get healthier and better. So the peer support, they have their own code of ethics that they also go by. Some of the topics in their code of ethics are competence, violations of code of ethics, recovery first, continuation of care, confidentiality, non-discrimination, personal integrity, your role as a CPSW, reporting, responsibilities, CPSW rights, and safety first. And I do have at the bottom, I do have the link for the entirety of the code of ethics for the CPSWs. CCSS training explains ethics as ethics are standards and guidelines adopted to provide rules for conduct. Professional organizations have code of ethics, social work does, psychology does, counseling does. So it's very important to know your agency's code of ethics and also the code of ethics that you are under due to your profession or certifications. Examples of ethical behavior in CCSS are do no harm, to act with integrity, honesty, genuineness, and objectivity. The client's well-being is the primary consideration. Confidentiality, keeping a client's information between you and the client and not telling others. Knowledge of state and federal guidelines and agencies, we can't express that enough. And then also competence. Services offered are within the CSW's ability, knowledge, and scope of work. This should be in every line of work that we do, that we make sure that we do offer that competence and know if it's something beyond our scope, if it is something that we, even if it is under the scope of CSW, but we don't have that knowledge, that we either seek out that assistance to make sure that we are providing the client with the best services. And if we don't know this certain type of work or area that the client needs services in, we can bring somebody in to help us. We can get with a supervisor. That's again where that supervision is so important of these credentialed professionals, so that they know they don't have to try and wing it or pretend that they know an area that they don't. And the other thing is if sometimes CSWs, the clients may think that they're a therapist, and for that CSW to know their role so they can know this is not my area, but we can get you over here. So that competence piece is very important. And that is very important as supervisors, that we assist our credentialed professionals in knowing their roles. So ethical decision-making, ethical dilemmas may arise in the course of behavioral health practice. Professionals should engage in a systematic process of ethical decision-making, considering the relevant ethical principles, laws, and professional guidelines, and consulting with colleagues, supervisors, or ethics committees can help in resolving ethical conflicts. I have my LCSW, I have my LADAC, and other things, peer support, CSW, but I still have my supervisors, even though they're no longer officially my supervisors, I still call them my supervisors. I still reach out when needed. I don't ever think that I know everything in this field, because you're never going to know everything in this field. So I still reach out, and making sure that as supervisors, there may be some difficult cases at times that we have with the people that we're supervising or with our clients. And we should never feel that we can't reach out to our colleagues or other people in our field to help us, even if it's just a sounding board, to make sure that we're on the right track. But I often reach out. I reach out to Lisa all the time because I want to make sure that I'm offering not only my clients, but the people that I supervise the best information and the best care for what we're doing on a day-to-day basis. So the importance of boundaries and work-life balance, defining boundaries in the context of professional practice. So ethics and guidelines are the rules. The boundaries help us to adhere to those rules. So we talked a little about what each role is for these credentialed professionals. We've talked about the ethics and the guidelines that they are to follow. So next is, how do we help them adhere to these boundaries, and how do we adhere to the boundaries? So anybody out there, when you think about boundaries, what are your first thoughts? You don't have to be formal. You can just unmute yourself. How about when you think about professional boundaries?
So there's a couple things in the chat, Michelle. Not sharing your own information, your own personal information, clarity in roles was from Allie.
Okay, great. So we're going to talk about professional boundaries. I've asked a few people about boundaries, like, when you think about boundaries, what do you think about? And some people, even in the roles that we have, some people think about like a fence or a border, or just something that is, it's a line that you know that this is that boundary, and that you be careful to try and cross it. So when we think, or to not cross it, whenever we're thinking about professional boundaries, there are a few professional boundaries. I'm sure there's more than this, but these are the ones we're going to talk about today. Today, we're going to talk about physical boundaries, emotional boundaries, time boundaries, intellectual boundaries, material boundaries, and digital boundaries. These boundaries are very important, not only for ourselves, but as we are working with our credentialed professionals, because we want them to make sure, we want to ensure that they understand these. Again, it starts by them knowing their roles, but as supervisors, this is a huge part of being able to make sure that they're able to do their job successfully. So some of our credentialed professionals, and I know for myself, boundaries is still a difficult thing that I deal with on a day-to-day basis. And I really have to make sure that I'm constantly, reviewing these, constantly discussing these with our clients, with our credentialed professionals, with our other teammates, because these boundaries are going to help to ensure that we're taken care of and that our clients are taken care of. Jen?
Yeah, I'm so glad that you're bringing up these different kinds of boundaries. And one thing that I was thinking of when you were talking about like a fence and things like that, some of the reading I've done about the pandemic, people have talked about their sense of a boundary being almost like much more, suddenly becoming much more fragile, like feeling like it was like this thin veil that teared, was the way that one article described it. And I think that speaks to how what you're saying, that there's kind of where these boundaries can be based off of what's happening all around us. There can be this like flux that occurs, or it can feel like things are shifting over time. And so, you know, I just wanted to throw that out there because I think sometimes we think of a boundary as a very rigid thing like a fence. And I do feel like there's also this kind of dynamic element to boundaries that can make it more difficult to navigate sometimes.
And what you're saying also, even like with the pandemic, boundaries that may have been before, it seems like there was a shift in so many things because we had to relearn to do different things. And so kind of those boundaries being redefined. So it is very important that this is a topic that is on our minds all the time, not only with our clients, but also with the people that we're supervising, because they do shift so much, they do change so much, and being able to make sure that we're up to date on those changes, we're being considerate of these changes, and making sure that we are not just closed-minded, closed off, and not being able to provide. I mean, as supervisors, we need to make sure that we know so that we're able to pass this information on. And then also learn from our clients. I learned a lot from my clients. They think that we're here to help them. And even our credentialed professionals, you know, they help us so much. I know that as a supervisor and anything we do, I learn on a day-to-day basis. So these boundaries that we're going to talk about, I know we can expand on them a lot, but I do want to touch on each one and make sure that we are not only aware of them, but we're sharing these with our clients and also with our supervisees. So the physical boundaries can be that personal space, physical touch. Healthy physical boundaries include awareness of what's appropriate, what's not appropriate, in what settings, and in what type of relationships. So as far as physical boundaries, I want to hear from some of you. What are some unhealthy physical boundaries that you've experienced or that you've supervised or observed? Unhealthy physical boundaries.
So I think space, this may not be a blaring example, but I think it's an important one. So sometimes when I do supervision, my supervisees are in spaces that are not necessarily safe for whatever reason. You know, maybe there's an issue in the room in terms of space and how to leave that space, or but I do think it's important. And I think as supervisors, I know that I in the beginning tended to kind of gloss over like, oh, people are fine, you know, and it's gonna, their personal spaces, it's gonna be fine. But there can be safety issues in certain agencies where people might need to get away, or they might need to call someone, like if you need a panic button, for example. So I think that that's something to really address with people, is like, do you feel physically safe? And if not, are there ways to mitigate that? You know, how do you ask for help in a crisis situation?
That's a good one. Any other unhealthy physical boundaries?
I'll just say from my own experience working in tribal communities, that kind of like what might be considered socially acceptable, like physical contact might be very different, you know, where it's like, I'm not going to, I think there's a lot of like, you know, majority spaces, you know, like in the metro area where it might be seen as perfectly fine to like go in for, you know, a side hug or, you know, something like that. Where it's like, well, that's not crossing a boundary. It's not like overly intimate or something like that. But, you know, I always want to be really careful about that because, you know, there's, I think certainly some communities out there where it's like, that's way too close. Like, and you don't know me like that. And don't, you know, don't do that.
Mhm.
Where we have to think about, you know, cultural differences in terms of what's a good or bad boundary.
Yes, thank you. What about some good physical boundaries? Just unmute yourself if you.
I think a way to establish, so one really good way to establish really good physical boundaries is to ask permission. And to say, if like, and even I use this example for kids, like if a child is, you need to kind of contain a child, I'll say, well, is it okay for me to take your hand? So like introducing those, like asking permission and saying, I want to make sure that you're safe. Is it okay that I take your hand? Is it okay, for me to, if it's appropriate, is it okay to shake your hand or give you a hug? And that's just in any relationship, not necessarily a professional relationship. So this idea of like consent in terms of physical boundaries and using your voice to implement a physical boundary.
Good. Anybody else in healthy physical boundaries? As you say that, Lisa, it makes me think of the different populations that we work with. And as we're supervising our credentialed professionals, they are going to work with various clients, whether it's mental health, whether it's substance use disorders. I think about some of the clients that I've had, maybe with schizophrenia or autism. And like you're saying, that we make sure to ask, because when we ask, then we're letting them feel comfortable, more comfortable with us. And then we're respecting them. So if I ask, is it okay if I shake your hand? And they say no, and they see that I'm going to respect that, they're going to be more open to work with us. I've had that with kids where I'll ask them at first and maybe they're like, no way, just no, I don't even want to be by you. I don't even want to be here. And then at the end, then they'll, ask at the end, then they'll ask me, is it okay if I, give you a side hug, or is it okay if I shake your hand? So that is a very healthy physical boundary, and being able to communicate with our voice and make sure that we are respecting those physical boundaries, and also putting, as we're respecting their physical boundaries, we're modeling, we're showing them what that looks like with our clients, with our credentialed professionals as well. But thank you. So emotional boundaries can include many things, from feelings, limiting what we share with our clients, with our team, with our coworkers, and then just preparing that information that we're going to share. We don't ever want to overshare. We want to make sure that those emotional boundaries are not violated by criticizing, belittling, invalidating other people's feelings, both our supervisees and our clients. Also being able to teach our credentialed professionals what this looks like by modeling as well, and also verbally letting them know these are things that we really do have to be careful with and take care of, and as we work with our clients, that we make sure that we are very careful about these emotional boundaries. Emotional boundaries can also be crossed and lead to inappropriate relationships. So I know it talked a little bit about there, but thinking about unhealthy emotional boundaries, does anybody have anything that they can share in that area about unhealthy emotional boundaries? I know that one of the emotional boundary areas that, as being a supervisor, that I've had to deal with is oversharing. I have some credentialed professionals, because they spend so much time with their clients, it sometimes feels that they almost are starting to become friends, and really making sure that we separate that, make sure that we remind the credentialed professional of their role in that, because that could be very harmful to our clients if we're oversharing. I've had where I did have some credentialed professional I had where they overshared, and then the client didn't want to call to bother them anymore because they felt that they already had too much on their plate. They didn't want to bother them with the things that they needed. So it could be something as simple as, even sharing about their relationship or their kids. I think we were talking the other day, some of our team was talking about even sharing that maybe even a pet passed away. That can be too much. We want to make sure that that sharing with our clients is kept to a minimal. So if they ask us, how's your family? We can say, oh, they're doing good. And then go on to a different way of, changing the subject and refocusing on the needs of the client and what you're working on to stay away from those areas, not to be insensitive in any way. But then the other thing is not wanting to, we were talking the other day about if you have a client that's crying or that's very angry over something, that we don't want to belittle or invalidate those feelings. Jen.
So I was wondering if you can say a little bit more about how you coach your certified and credentialed folks on this, because I think, particularly when somebody has lived experience, which is true for all the peers, but can be true for some of the other roles that you've covered today, that, there's a lot of expectation that this person is there, to share that lived experience, and which I think clearly has some benefits. We know that, somebody working with a peer, knowing that they're not alone, they're not the only person who's like dealt with recovery or whatever else, there's benefits to it. And kind of like, how do you help a peer think about like what feels, what's over the line, or what feels too raw, or what is, am I starting to center myself? Because I think that's, some of the challenges that can come up with these emotional boundaries.
Yes. Joshua, do you want to speak to that?
Yes, I know for me personally, as I work with clients, my lived experience is definitely time sensitive. I can share on something that was, a couple years old as opposed to something that happened last week, where like how Jen said, how raw something is, if once you've healed through something and you've worked your way through it, now you actually have the lived experience to share how to work their way through it.
Yes. And then the other thing that I know that we work a lot on is not having to give all the details, because sometimes, because of these peer relationships, the client will want, to try and pull a lot of those details, or to try it. Sometimes they try to sidetrack so that we're not focusing on what they're going through, and they want to pull that stuff from us. But really making sure, like Joshua said, that it's time sensitive and that it's appropriate to what you're working on. I know that I've heard a lot of our credentialed professionals, whenever the client tries to get them to talk about it, I do hear them say, you know, they may tell a little piece about their story, but it won't be fully detailed, and it's going to be relevant to what the client's going through. And that's how we try to ensure that we are being sensitive to that peer relationship, but also, again, not oversharing, that they don't have to give all those details for it to be effective in that peer-to-peer relationship. So this one it's tough, because again, you spend so much time sometimes with some of these clients in that peer support role, or the CSW role. You're taking them to the doctors, you're going to the stores with them, you're taking them and teaching them how to, you know, go to different types of groups and socializing. And so you're spending a lot of time with these clients. The other thing that I just thought about too is, as we take them to different groups, there's some groups that we're going to take them to that we're not going to go to ourselves. So say we go to an NA group and we take them there so that they can get comfortable. We're not going to spill everything, our stuff, as the credentialed professional. We're not going to spill all our stuff there, because then that could blur that relationship. So it's that one. The emotional boundaries is one of the harder ones. Anybody else on emotional boundaries? Thank you, guys. The next one is time boundaries. This is another difficult one. Our time is valuable, and it is important to protect how it's utilized. Setting time boundaries is incredibly important at work, home, and socially. Setting time boundaries means understanding your priorities and setting aside enough time for the many areas of your life without overcommitting. When you understand your priorities, it is much easier to limit the amount of time you're giving to other people. Time boundaries prevent burnout. So with the time boundaries, there can be healthy time boundaries, there can be unhealthy time boundaries. Would anybody like to share either of those that they've experienced, either personally or with their credentialed professionals?
I just want to share that this is a huge one, and it has circled. I've had a hard time in my life dealing with time boundaries, and I'm getting better and better. I'm still not perfect. It's just really hard when you're working with human beings who, we can't necessarily get to the end of something within a 50-minute period. If you're doing therapy, that's a little bit more flexible if you're a CPSW or CSW, but also I think that makes it harder, because as a credentialed professional, there aren't as many time, sort of boundaries built in around services. And so you could potentially be with a client, for hours, or someone that you're working with, and it can be really exhausting. And to be able to say, okay, we're going to meet from this time to this time, it's hard. It's a very difficult thing to navigate. And because they're, especially if peers are jumping over into the friend zone, and then there's like, oh, we need to stop, that can feel rejecting, it can feel difficult. So this is one that I think we always have to talk about.
Yes, agreed.
And somebody in the chat, there's some stuff from Ariel. I have a hard time sometimes not letting a client go overtime by a significant chunk. And then Rachel says something too. I don't know if you want to address that.
Let me see the chat.
So I just was sharing a personal example where I was in session with a client who was in crisis, and one of my LSAAs interrupted my session without knocking, pulled me out of session because he was having an issue with one of his clients, and it disrupted my time with my patient and was not honoring his time of therapy.
Mm. So how did you address that?
So my client became insulted and left, and so I had to wait until his next session to address that with him. And with the my peer professional, my LSAA, I had to first check my feelings and be a professional myself, but then kind of let him know that I understand that his needs and his situation are important, but our client's time is important too. And just sort of reframing his focus on that.
After that time and being able to discuss it with him, did he understand the importance, and has he been able to set up better boundaries?
Yes. With me, yes.
Yeah, this is a hard one, the time boundaries, and again, ourselves, and then also teaching this to our credentialed professionals and others that are in our agencies or on our team. This one is difficult.
Michelle, I wanted to, because I just think that you're really good at this, and just I just want everybody to realize Michelle has like 4 agencies now, or 4 offices in an amazingly short period of time. So I would love to hear from you, Michelle, about how you train, how you work with credentialed professionals around this issue. And Joshua, if you want to chime in, or Samantha, about how, if there's learning experiences that you've had, because this is just so important.
Joshua, I
Yes.
saw your hand up.
Yes. I could talk about this all day. The whole process of what I do hinges directly upon Michelle's guidance, and having that open dialogue where if I have questions, if I have concerns, I can immediately connect with her. That's very important. The other process when it comes to these boundaries, I'm not gonna mix words. I bump my head against every one of these boundaries. That's how I learned them so well. Of going over time boundaries, and learning that you can't inform your client that you have to go see another client. That's why your session is ending. That's not a good thing. So to address that question, Michelle is very on hands with us, but loosely.
So yes, I try not to micromanage, because I do want our credentialed professionals, I want them to learn these things. And we're going to talk, we have a video coming up here in a little bit, so we're going to talk a little bit about that. But as far as the time boundaries, I guess over the years, I've had a little bit of experience in different types of supervision that I have had. And so what I decided whenever we were going to start this agency, I decided I was going to take all those good things and bring them with, and all those bad things I was going to leave. I do not try to micromanage anybody on my team, but I do work hard at making sure to help them understand how important this time boundary is. And most of all, it's because I don't want them to get burned out. I need everybody that's on my team, that's on our team right now. I need them to be able to go for the long haul because the needs are so great. And I will tell them all day long, I am the worst person at this, but I am getting better. I'm learning how to delegate. I'm learning how to share different tasks with different areas and be able to let them know, you know, this is not what it should look like. This is what it needs to look like. And then I'm able to be honest with them as I go through these things so that they're able to see how to handle it. But the main thing is I do not need anybody on our team getting burnt out. That's on the credential professional side, that's on the supervision side. But then on our client side, we also have to adhere and take care of our clients and make sure that we're giving them enough time, but also the way as I work with our CSWs, our CPSWs, our goal is to grow our clients up and out. So if we keep it looking like that, we want to grow them up and out so that they eventually are able to do a lot of these things on their own. That's what the goal is supposed to look like. Jen?
Yeah, I just wanted to say I really appreciate you talking about your own process with that, because I think in terms of supervisors, this is the boundary that a lot of people are not great about. You know, where we are really good about setting the tone with our supervisees, but then we don't always hold ourselves to the same standard. You know, without thinking about, like, I mean, just like all of these other boundaries, like, we're modeling this. And so if we're not actively trying or actively acknowledging, like, hey, maybe I crossed a line with myself, you know, by working longer hours. And I think, I mean, that there's a lot I could say about why we feel more able to compromise on this boundary, because a lot of times it doesn't feel like it's hurting other people, it's just us. But you know, I mean, and some of you were in the self-care presentation, and I mentioned this in that one too, but you know, somebody just recently shared with me about a supervisor where they were discussing this time boundary, and the supervisor told this person, like, don't be like me. And I was like, oh no, that's you know, that's not like, we have to do better as supervisors. And I think maybe there needs to be kind of like that accountability within organizations on that, you know, like, honestly, like, Lisa has like straight up given me feedback about that for myself before. And I appreciate it, because I think yeah, this is just such an important one, and such a one that supervisors struggle with.
Yes, I definitely agree. It is that we want to say, do as I say, not as I do, but that's not how this works. Just like we want our credentialed professionals to be able to teach their clients this modeling, then just like you said, that's something that we need to do. And I like what you said is about the accountability. I'm one to justify this one. I can justify this one all day. I love what I do, so it doesn't feel like work. I'll use that all day long, every day, and it doesn't feel like work. You know, I get to do what I love to do, but if I'm not taking care of myself, then, you know, like that mask that comes on in that plane, you know, that mask that's going to drop down in that plane with that oxygen. If we're not putting it on ourselves first and taking care of ourselves first, we're not able to take care of anybody else, not our families, not our team, not our clients. So lately, I have been asking for a lot more accountability in this area, because I am horrible at this. And, you know, I'll be doing paperwork in the middle of the night, typing, and I often send out messages and I tell my team, don't answer. And then they'll answer me. And then I'm like, don't answer. And they're like, well, why are you still on? So yeah, this one's a tough one, but accountability is very important in this area. We want to make sure that we're teaching proper time boundaries to our credentialed professionals, in turn, that we can do that for our clients as well. So the next one we have are intellectual boundaries, and these refer to thoughts and ideas. Healthy intellectual boundaries are respect for others' ideas, appropriate awareness, what we should talk about, not talk about. Intellectual boundaries are violated when someone dismisses or belittles another person's thoughts or ideas. Intellectual boundaries also happen when we try and impose our beliefs on others. So I went through a cultural competency training. I don't know if it was last week or the week before. And really this one reflects a lot of that ethical and the cultural boundaries and the cultural competency, and making sure that we ask, like how, even about the touch, asking about that personal space, how important it is for us as supervisees, and then also with our clients, to ask these things of our clients, of our supervisees. We never want to impose our beliefs, no matter what they are. Even if they're the same beliefs, we don't want to impose our beliefs on others. Can anybody speak to intellectual boundaries?
I had a session a couple of weeks ago with a client that I found interesting because in the cultural competency courses that I've taken, I hadn't had like a good way to address internalized racism, but also addressing racist comments when they come from people of color. So I had a hard time not being like that's not right. We can't say that.
Mm-hmm. How did you work through that?
Probably not terribly well. I addressed it in the way that the client had phrased it, which was the way that they phrased it implied that like I would believe it too. And so I said, did you say this? Because like that's not necessarily a belief that I hold. And then it still got weird from there, but I felt uncomfortable being like, I have no idea how to like, yeah, go about this.
I appreciate your honesty with that, because I think there are a lot of times in session or with doing supervision or working with clients that we do feel uncomfortable at times. And I really, for myself, a lot of questions and asking, what did you mean by that? Or those types of things for me have helped me understand maybe where they're coming from, or, sometimes what they say is what we thought they said, but sometimes it's not. So I like that you did ask some questions. But there are a lot of times where we are going to have those uncomfortable moments. And I think questions is a great way to help minimize that uncomfortableness. Joshua.
Yes, as I work in the community with clients, I have to remind myself about this boundary, because I am working in the 5 domains to achieve clients' goals, not my goals. And so we may have a client that decides they want to get a fishing license, but they, in my opinion, they may need an EBT card. More importantly, that's where this comes into play, where I have to remind myself, my goals are not their goals, and what my job duty is to help them achieve their goals.
That's good. And it could be, I think we're talking about some of these boundaries the other day because we had a training, and even just thinking about, it could be something subtle, like with the credentialed professionals, whether it's a CPSW or a CSW, and it could even be with a therapist. Sometimes we might not think about these things, but I know sometimes we do this to our children. They'll go grab a soda instead of milk or juice, and we'll be like, is that really what you want to drink? And we have to make sure that even those subtle things, that we're not imposing what we want, like Joshua said, what we want them to do, we're not imposing that on them. So it could be something as simple as like, Are you really going to have another cup of coffee? Or, you know, it could be something small, it could be something big, it could be something as big as, you know, religion or anything like that. But really making sure, like Joshua said, that we keep our clients, it's person-centered, it's client-centered in everything that we're doing, and really respecting those intellectual boundaries, not only for our clients, but also for our team and those that we're supervising. Anybody else on intellectual boundaries? Thank you. Next one is material boundaries. This is also a very difficult one that I see for credentialed professionals, again, because they are with the client so much. A CPSW can be with the client for hours in a day. A CSW can be with a client up to 4 hours in a day. You begin to, you know, spend so much time together. Sometimes it does feel like family or friend kind of relationship, but making sure that we have to keep those boundaries. But it can be different things with the material boundaries, can be money, clothes, vehicles, homes, but making sure that we do not cross this boundary, because then once we do it at the beginning, then it's just going to continue. And then if you stop, you're going to get that resentment from the client. And so with this one, I think one of the huge ones that I see from the supervisees that I have had is food. And even for myself, that's been a hard one, because most of the time you'll see people and that's something that they're asking for. You know, I'm hungry. Food is something that is welcomed in bringing people together. So it could be either way. It could be us providing food to clients. It could be us, you know, accepting food from clients, or, and these material boundaries go both ways. It's not just us providing them to the clients, but it's also them providing them to us. Does anybody have any material boundary stories they want to share with us?
I can share.
Thank you, Charlene.
Yeah, so we actually just had a conversation with quite a few of our staff. We have a couple shelters that our behavioral techs work in, and part of the thing was purchasing like snacks for some of the youth. But that was definitely something that was becoming an expectation for the staff to bring every time they were on shift, or even when they weren't there, the expectation was going on to the other staff as well. And that also was becoming like staff splitting and favoritism within that. And it's just as simple as just like a bag of hot Cheetos, or like a Starbucks or a boba tea, and it can just get really messy like pretty quickly. So we just had this whole conversation this week, just making sure that we do set this boundary, and kind of explain like the reasoning behind that.
Yes, I like that. And I know in our offices, we kind of just do it as a blanket. We provide snacks for everybody, so it's not specific to a certain client. So I like that that is getting addressed, because that definitely can be a hard one, and that favoritism can, those feelings can come up in our clients. So thank you. Anybody else?
Michelle, there was one time I had a situation presented to me by a supervisee who oversaw credentialed folks, and she became aware that there was somebody on the team who, you know, because when you do home visiting, of course, like there's times where you may be offered food, and there could be cultural reasons that it could be considered like particularly disrespectful to turn that down. But with this person, basically he did accept it one time when he was there, and then he liked the food that the family prepared, and so he started planning his visits for their meal times, and was openly acknowledging like, well, yeah, like I went to I forget what kind of food it was exactly, but yeah, he like wanted her tamales or something like that. And, you know, she had to really step in and say like, hey, this isn't acceptable. Like there's a big difference between being culturally respectful, you know, by accepting food versus like I'm expecting to receive food while I'm on this home visit.
Yes. And that is a tempting one, especially tamales. If it was tamales, the way that I have found a way around this, and that when I work with my credential professionals or anybody that I work with, is I often will take a water bottle with me in, or my cup in with me when I do a home visit. And so that way I don't have to worry about them offering me something, and because there is that cultural thing. I mean, for us, food, I think most cultures, food is a big deal. And so we don't want to be disrespectful or show signs that we might be being disrespectful. So another thing I use a lot is, oh, I'm so sorry, I just ate. And just make that a habit of, and not showing up around food times if you know that some of that stuff might be tempting. So those are some of the types of things that we try to teach us to make sure. And I'm not going to say that I've always followed that, because there were times I've gone, you know, to certain homes and certain places that, you know, they did not let you get away without having something to eat. I remember one time on the reservation, I went somewhere and I don't know what it was, but they were having a feast, and I didn't know that feast was that time. And so, you know, that was a time that I did, because I wasn't going to disrespect them by not. So it as it happens, then you're able to adjust going forward, but making sure that we're appropriate with these material boundaries is really important. So I know I'm looking at my time, and I'm gonna need to speed it up a little bit. I didn't realize I was worried about not having enough, having too much time. But digital boundaries, this one is huge nowadays. We were talking about COVID and everything going on with that, and how things have changed so much. People communicate through technology so much. And with the digital boundaries, that could include social media, email, messaging, work communications, online dating. It talks about all types of digital boundaries. So it's very important, not only the type of technology we're using, but how we're sharing our information on those digital boundaries. So making sure that if you have personal information on your social media, that you are not accepting your clients as friends, because you do not need them coming over. You know, that started with in the beginning, those personal boundaries, those boundaries that we don't want our clients knowing that personal business for whatever reason. It can be, you know, that we want to be sensitive to. Maybe our clients don't have a home and we have a home. We don't want to be posting pictures or let them have access to, you know, pictures that might show our home. Or sometimes even things as having them picture, you know, with a parent or a child, and maybe they've just lost a parent or a child. So those digital boundaries are very, very important that we be careful with and that we guard, especially nowadays, because the technology is so out there. The other thing about the digital boundaries is we've talked about in the middle of the night, if you're getting messages from your clients, you know, letting them know that from this time to this time, we won't be accepting those. But if you do leave a message, I'll get back to you during work hours the next day, things like that. So it's very important, and making sure that anytime you use any type of technology with clients and with your supervisees, that it is HIPAA protected. Make sure that they're not messaging you through, you know, Snapchat or Facebook or Messenger, anything like that, because we also want to adhere to to the guidelines and the laws that are out there. Any digital boundaries out there that anybody has had issues with?
I think this is a good one, even just for just in what I'm doing with supervisees. I have several times where supervisees will friend me on Facebook, and I really do have to say, I don't do this with supervisees until, time passes and you've graduated and moved on, and and significant time has passed, and then we can talk about friending on Facebook. And for clients, and I just think for me, it's an absolute no-go. And because and this is important to understand, is that people will Google you as a whether you're a CPSW, a CSW, an LSAA, a PhD, they're gonna Google you. And so just being really aware of what your digital profile looks like also.
Exactly. Jen put about a Google number. We do have our, all of our employees get a Google number. She said, because you have that do not disturb, you can turn it off and on. That's really important. And then, yes, I saw something else come down though too about the Google number. Oh, and then Ariel said about having clients texting and asking for advice is seeking the therapeutic support outside of sessions. So yes, making sure that we keep those clear boundaries there is very important. So maintaining professional boundaries, maintaining clear and appropriate boundaries is essential for ethical practice. Professionals must avoid dual relationships, conflicts of interest, and avoid any behavior that may blur that professional and personal relationship. Setting and maintaining boundaries protect the integrity of the process and ensures client safety. So some techniques for maintaining professional boundaries is regular supervision and consultation. So keeping in regular contact. I do have weekly supervision with my employees, with our coworkers, and then I also have brought on a lead for the peer support workers and the CSWs to also give them additional supervision and consultation, so that way there's not only myself, but and then also we have each other. We have them, reach out to each other if they have questions or if one is knowledgeable in one area. So we make sure that we work together to hold each other accountable in these areas. Peer support and accountability groups, continuing education and training on ethical guidelines, and implementing policies and procedures to address boundary issues. So I do have a video, but because I want to make sure that we stay on time, I wanted to go ahead, instead of doing the video, I want to bring on Joshua and Samantha, who are some of our support workers. And I want to just question them a little bit. So if I can have you guys jump on.
They're there, Michelle. What might be helpful is if you want to stop sharing your slides, you can see them better.
Okay, and then it'll let me come back. Okay, so stop sharing. And we have Joshua and Samantha there. I want to see, let's see, view. I'm gonna do speaker view. Awesome. Okay, so Joshua and Samantha are some of our support workers. And I wanted to just touch base a little bit with them about what boundaries look like before they had a training and when they first began, because we kind of, when we started this whole Herron Solutions, we kind of were, I used to say faking it till we make it, but we're faithing it till we make it, because it happens so fast. So the training that is happening now is not as it was before. We were kind of learning as we go. So I kind of just want to hear from them as to what their boundaries look like before compared to now. And so if you guys can speak to that a little bit, as what did your boundaries look like working with clients before, in the first few months of your CSW work?
So when I first started, I didn't have boundaries. And I didn't realize like how much that I was actually hurting the clients instead of helping and walking alongside them. Like they would call me like, I need a ride here, I need food, I don't have a place to sleep tonight. And so not having boundaries, I would solve their problems for them by buying them food, finding some type of shelter. And now, like, I know it's hurting them more than anything. And so now I'm able to connect them with resources like food boxes. Our shelter in Socorro will provide some type of shelter for them by buying them a motel room. So I'm able to connect them with that resource now.
Awesome, thank you. Joshua? What did it look like before?
Well, before I was having the lived experience, it made me prone to cross boundaries, because I felt a connection to their struggles, because I suffered and worked through the same struggles. So I did some of the same types of things Samantha did. I would get motel rooms, buy food, rides all different times of the day, unknowing that going this far plants seeds of resentment for the future. Because when the dynamic or the relationship changed, the resentment built, because now I'm not there doing all the things I shouldn't have been doing in the beginning. So I think that's what Samantha meant by we were harming as opposed to helping. And more so, doing all these things for a client robs them of their successes, robs them of their independence. It robs them of many things. And I think as once I did take the training for CSW, and with your guidance, I was able to see exactly what my job looked like. And once I was able to see exactly what my scope of work is and was, it made my boundaries so much more clear. Does that make sense? So knowing your role goes hand in hand with adhering to boundaries. And kind of like how Jen said earlier, the boundaries do shift, not by a whole lot, but they do shift. I'm not much of a hugger. I can shake hands, but if something does happen traumatic, I do ask, do you mind if I put my hand on your shoulder? That way I can have a connection where they know I care and I'm feeling what they're feeling. And more so than that, also having a lived experience, we're able to say, I know exactly what you're going through, because we do know exactly what they're going through. And also we're able to operate, we're not therapists, but we're able to operate outside of the constraints that a therapist has to operate within, because we are out in the community, we are in certain places, we are connecting people with resources. So I think as we work with you in our company, we're able to see what true wraparound services look like.
Thank you. Does anybody have any questions for Joshua and Samantha?
I do. And I just want to say thank you for coming and being here. I just think it takes a lot of bravery and to do something like this. So thanks, Joshua and Samantha, for coming. Also, I just wanted to ask, were there any gems that you were taught that you were like kind of like having an aha moment where you're like, oh, now I get it?
I think the saying nothing about us without us was just an eye opener for me. You know, and as I do this work, I'm able to see what the layers actually truly look like. I know throughout my life and where I'm at now that I did the work, changed my life, but then what? So this type of work boosts us past just overcoming a struggle. And so now we're able to help others reach behind, pull them up as we're being pulled up. So it's a multi-layered addressing of not just substance abuse. You know, there's so many other things that fall under this umbrella, but that was my aha moment to see how many layers there are to this.
Thank you.
And I think we've talked a little bit about it too, is we really push doing with, not for, not for, because even for myself, it's so easy for us to do for, because we can do it faster, or we know how to do it. But then like Joshua was saying, that robs from our clients, that robs them from having those successes. So as we're doing with, we're doing those modeling, and we're helping them to see that they are able to achieve these things. And I've really seen Joshua and Samantha be able to, as well as a lot of our other support workers and peer support, as they are able to show their clients how to do things. Then when that client calls now just for maintenance, they're able to remind them. I know Samantha, they're very good at reminding them, okay, how did we handle this last time? What did this look like last time? And they're able to remind them. And so that, I think we were talking about the other day, you know, success looks different for everyone. But even if it's a client being able to make their own appointment now on their own, you know, even if we still have to go with them to the appointment, things like that is so important. And just being able to step back and remember that, just like with our clients, sometimes needing those little steps, we have to remember that with our credentialed professionals, with our supervisees, that we also need to remember that, you know, we can't just say, go do this. We need to break it into those little pieces. And that's what's going to make them be able to then be able to teach others, then be able to teach their clients. And our goal, my goal is always to bring that client from that other side and empower them. You know, not everybody's going to be able to do that, but empower them that if this is something that they too want to do, to be that peer support worker, to be that CSW, to be that LSA, to be that LADAC, that we help them achieve whatever they can achieve to maybe come on this other side to help others, if, you know, that is something that they want to do. So thank you both. Appreciate
Yes,
you.
absolutely.
I had a quick comment, and I don't, you know, any of the three of you may have something to say in response to it, but, you know, one thing that I talk about a lot with boundaries with folks is about not basically the accountability that we have to take for setting that tone, setting those boundaries with clients, because there's so many times where I think folks can sometimes feel like, oh my gosh, I can't believe this client asked me for this. Like, they have poor boundaries. When I think in reality, it's like they don't know what the scope is for any of these different professionals. And really, like, the burden is on us to like let them know about that and not shame or blame them, since that can also really harm some rapport. And I think sometimes because the client may make a request, you know, like, right, for money or whatever else, that sometimes that is what makes the provider feel like, oh gosh, like saying no is hard. So I don't know if I can do this, you know, and feeling like those boundaries are already being tested just by like receiving that ask.
Well, if I may, I've learned with boundaries, you know, And I think a lot of the times we misunderstand that boundaries, we're not setting rules on anyone else. We're not trying to exert control over anyone else. We're just setting a standard of what will happen. If this happens, this is what I'll do. And more so as we do what we do, as we set boundaries, gently, of course, in a productive way, and we're modeling more behaviors. Because now not only does the client know what healthy boundaries look like, they know how to set them and maintain them without hurting or demeaning another human being.
And I think our functional assessments do that right up front, because we're
Yes.
able to, during that functional assessment, we're able to let them know this is the scope, this is what our role is, this is what we're able to do, this is what our time will look like together. And as we set that with them right up front, then it makes it easier going forward to be able to remind them, okay, remember, we talked about that last time, or these are the ways that I can help you. So I think we do our functional assessment first visit, and that really establishes that foundation, and we'll remind them that we'll keep going back to that, and we're all on the same page there, so that, Joshua's working with somebody and then I have to come and pick up because they're working with other clients or something, that it's right there and we're all on the same page, literally. So that just having those practices and that training in place, I think has helped us. Not before, because before we didn't really know what we were doing, but we're establishing these things to help us move forward, to make sure that we're all on the same page.
And as we set these boundaries and as we interact with clients, we're setting up these micro structures to go into the macro structures and how people should interact with their family, their friends, their community, what responsibility looks like, what paying your taxes look like, the benefit from by doing all these things. And slowly you're able to, through MI, of course, you're able to paint a picture with the client, of course, to see on what life can look like in the future.
Awesome. Thank you, guys. I'm going to go ahead and share my screen again. Slide. Okay. So thank you. I really appreciate that. So the importance of having qualified professionals on the team. Benefits can include expertise, credibility, quality of care, enhanced interdisciplinary collaboration. The experience that credentialed professionals bring is so important. That's where I began. That's where I started. That lived experience, being able to, go through these things, come through the other side, and then want to help others. And that's where a lot of these credentialed professionals come from. So shortly after becoming an independent therapist or beginning independent therapy, the need came for these credentialed professionals, because I knew that in my 1 hour per week, I was not able to help them, find a job, do a resume, get a social security card, birth certificate. So, all of these things that are so needed. And that's where a lot of this assistance comes in, that we need these team members. We need to be able to offer our clients, like Joshua said, those wraparound services, being able to not only just offer them the therapy, but also be able to assist them with their day-to-day living needs, helping them to live this, if they want to live a different lifestyle and not have to live in substance abuse anymore, that we're able to give them those supports. If they're dealing with mental health stuff, if they aren't able to meet their medical needs, that we're able to come alongside them. So we really realized how important and how large the need was. So that's when we started bringing on credentialed professionals, from LADACs to CPSWs to CSWs. And what we've tried to do from the beginning, again, I wanted to take the good that I've got from other places that I worked, and I wanted to learn from the things that were not so good. So what we've tried to do is create a workplace where we have a hiring and our onboarding process that's clear, that people understand it, that's the same for everybody. We try to offer training support. As often as I get free ECEU information, I put that out there. We try to train as much as we can in all of the areas to make sure that all of our credentialed professionals are well-rounded, as well as our therapists and counselors. We offer above market compensation for not only our therapists, but for our support workers, our CPSWs, all of our credentialed professionals. We do offer above market compensation. We do regular and consistent supervision, which is weekly. We do have accessibility to leaders and supervisors almost all the time. We do offer benefits, different types of benefits. We partner with an insurance lady who helps us do the Be Well New Mexico. We provide part of dental and vision. We provide life insurance. We also do the PTO. All of our credentialed professionals are W-2 employees, as they are supposed to be. And we do offer we try to offer at least a couple times a year where we get together as company and bring our families together. Career growth encouragement is a must for me. I want people, if they want to grow, I want to encourage them to grow, because I want them to get that education so those doors will open, because this is work they can do for the rest of their life, and it's much needed, and I don't see it going away. So I really try to encourage that growth, that personal growth, that educational growth, that professional growth. We offer safe work environment and then access to our office space, equipment, and supplies. So there is absolutely no way that we could do the job for our clients without our credentialed professionals that we have on our team. We have an amazing team with amazing stories that are willing to serve these clients to the best of their potential. And there's just no way that I could do what I do without them. This is our team. I don't know our numbers right offhand now, but we're in the 20s. It's been about a year and a half, and this is not anything that I could have ever imagined, but I am so honored and blessed to be a part of this, because again, the hearts of all of this team is for the clients, and just being able to come alongside people, help them to be able to, walk through another day, to give them that hope, to encourage them to be that support when they have no support. So I'm so thankful for our Herron Solutions team. So do any of you all have any credentialed professionals on your teams? Anybody?
I have some on my team, CSWs.
CSWs, awesome.
Yes.
Awesome. I'm sure you all know they're invaluable, and that they just bring so much to our team. I know we couldn't do any of this without them.
PIA programs for children has, and a lot of UNM programs, also ASAP, which is I'm not going to go with the acronyms. This is one of the substance abuse programs that I'm losing the acronyms in my head. Anyway, there are several programs at UNM that are more and more using certified and credentialed professionals. And, there's also really great trainers who are CPSWs at UNM. So I'm just happy to see that, because like you, Michelle, when I've had CPSWs on my team in the school-based health center, it just made my job so much easier, and I just think it's going to get better and better with presentations like this, and with professionals like you who are willing to take the chance on credentialed professionals. So yeah.
Yes, and
And I
just
also
the
have this,
outcomes of our clients are so, it really does, they're impacted by having these people on our team.
yeah, and I just want to give a plug to you, Michelle, too, for, you know, offering a living wage for the work that CPSWs and CSWs are doing. That's not always part of the course, unfortunately. I think we're trying, and especially in New Mexico, it's getting better and better. But I just think that, I don't know, I just see you as a pioneer in all of this in many ways.
And just, I'm so blessed to be able to be a part of it. Because like I said, I've just been able to watch it as it has happened. And I want to make sure that not only do the clients know their value, but that our coworkers know their value as well, because then they're going to be able to provide those services to the clients that are much needed. And I think, again, I thank God for the great supervision that I had through you all, because that definitely helped to get us where we are today all the way around. In conclusion, the ethics are important for credentialed professionals to understand and adhere to, and they're only going to be able to know how to do that if we're providing good supervision, if we're being there, if we're being available to make sure that they are able to understand their roles. Teaching boundaries and constant supervision are not negotiable. They're non-negotiable. We cannot negotiate those things. We have to be very clear, very concise. And credentialed professionals on our team are essential. There's no way that I could do this without them. And I'm just so thankful to have the team that we have. So I thank you guys today for being here, listening to all of this. And I thank you for entrusting me to be able to do this. So this is my contact information. I'm always available to share whatever information I can with anybody, because I know that wasn't always available to me at the beginning. So this is my contact information. And our next slide is going to be our QR code. Make sure to scan this QR code. You have 48 hours from today to make sure that you complete this evaluation so that you can get your certificate, and screenshot it, save that email, make sure that you get your credit. These CEUs are always valuable in the work that we do, so make sure. And I just, again, thank you guys so much for being here today.